gonna catch a cold from the ice inside your soul. So don't come back for me. Who do you think you are?
All right, I'm not sure exactly what that song's about. People talk about my music being strange, but people going around putting jars of hearts. I don't know. Anyhow, I'm sure it's something more poetic than that, and very touching and all that good stuff. But if I went around saying that kind of stuff, they'd lock me up. All right, we were on number 16, and we just finished up number 9, I believe. We said that the agranular leukocytes, or white blood cells with no grains, were the monocytes and the lymphocytes. Okay, and those are letters E and G on your particular matching right there. Now, the next one says number 10, fragments that form platelets. Basically, B up on your list says megakaryocytes. Okay, mega meaning big, okay, or large, mega millions, mega store, or whatever. So mega meaning very large, karyocyte. All right, this has to do with cell that has a nucleus, and so you have this big old giant cell, and then it blows up, and when it blows up, it makes these little pieces, which are the platelets, and so that's where the platelets come from. They're little pieces of cell, and they kind of seal off and make little pieces, or platelets. All right, number 11, A through G on your list are all examples of the formed elements, in other words, the cells that are in the plasma of the blood. Number 12, it says increases during allergy attacks, that is C. Eosinophils are the ones that, when your allergies kick in, so a lot of times if you're doing a blood test, they can tell if it's just allergies or is it some kind of infection or something by looking at the eosinophil numbers. Number 13, basophils are primarily has to do with releasing histamine when something's inflamed or you have some kind of reaction to stuff. If you have a cold and your nose starts dripping, that's the histamines. The histamines are trying to wash out whatever it is that's causing the problems in your nose, and that gives you that nice drippy nose. If you take a medicine called an antihistamine, then it dries that up and keeps your nose from dripping. Okay, which kind of defeats the purpose of trying to wash out the allergy stuff, but at least you don't go around with a drippy nose all the time. Number 14, after originating the bone marrow, may be formed in lymphoid tissue, that is G, the lymphocytes. Remember, the lymphoid stem cells are made in the bone marrow, but then that goes to the lymph glands and other lymphoid tissue and gets programmed to attack specific things. Number 15, red blood cells, or the erythrocytes, the RBCs, are going to be the ones that contain hemoglobin and pick up the oxygen and so forth. Number 16, primarily water and non-cellular. The fluid part of the blood would be, of course, I, or plasma. Number 17, during prolonged infections, if you've been infected for a long period of time, then that's where your monocytes down here. Okay, the longer the infection around, the more of those start showing up. And number 18, the least common leukocyte, which is the basophils, normally most of the time are your basophils, except for when you have you're doing the histamine and making your nose drip and all that good stuff. Then also called the white blood cells then would be C, D, E, F, and G. So basically C through G, all of those are types of red blood cells. All right, then going on, platelets are not cells, okay? Technically, they're just fragments or pieces of these megakaryocytes. Karyocyte has to do having a nucleus, so they have many nuclei. It's just a giant cell with many nuclei and stuff like that, and has all these different nuclei in it, and then it breaks up in little pieces, and these little cell fragments become the platelets, and they kind of seal themselves off and make little mini cell type things, and those are your platelets, which will later become important when it comes to clotting. All right, now we haven't had a really big word in a while, so it's time to get another one. We have hematopoiesis. Okay, hema means blood. Poiesis means to make. Okay, so basically this means to make blood. So it's the formation of blood cells, or forming blood cells, or making red blood, or all blood cells. we'll talk later about erythropoiesis, which means only the red blood cells. I suppose you could have leukopoiesis, and that would be the white blood cells. But in this case, it just means making blood. So all the blood cell being formed, and it happens in the red bone marrow, which is found in your flat bones and the tip of your femur and some of your other long bones, but primarily your femur, and then the flat bones such as your skull, your sternum, things like that. Okay. Now, keep in mind the red bone marrow is also known as myeloid tissue, which makes sense since most of these cells come from myeloid stem cells. Then the myeloid tissue would be the red bone marrow that makes these different blood cells and that come from that. All right. Now, speaking of making red blood cells, you have trillions, if not even more than that, probably more than we can really kind of estimate the number, but basically red blood cells in your body. However, they're constantly dying off and they're constantly being replaced. All right, and in general, they live somewhere from 100 to 120 days. Just depends what happens to them. Okay, so how long do they last or not? How much wear and tear they go under. But basically, they have to be replaced every 100 to 120 days. Now, there's always some of them wearing out, and there's always new ones being made at any given time. Okay, now once they have worn out, okay, there are phagocytes, which, if you remember, phagocytes means, phago means to eat, so these are eating cells. They're cells that eat other cells, if you want to think about it. And in this case, these phagocytes, which are found in primarily in your spleen and liver, although there are some other tissues that do it, but primarily your spleen and liver. As the blood comes through those two organs, they look for ones that are defective and stuff, and these phagocytes will take them out of the tissue. Okay. Now, the good news is, if you need to boost your RBC production, is it only takes about 3 to 5 days to make a red blood cell. Okay, to go from the myeloid stem cell to an erythrocyte doesn't take too long, and so you can replace them fairly quickly, and this is why you can give blood, and then within a few days, a week, you're good back to normal. Although they usually make you wait, I think it's about a month or so before you actually give blood again. All right, now once again, we kind of talked about this before, but when you have cancer patients and they're undergoing chemotherapy, which just means drugs that are being injected intravenously usually, they kill rapidly dividing cells. Well, since you constantly are replacing red blood cells, they are considered rapidly dividing cells. And so very often the cancer medications and stuff like that will attack the white blood cells and the red blood cells, since you're constantly making those. And so usually doctors will monitor the RBC levels and the WBC levels, the red and white blood cells, and make sure that they're not getting too low, because then they may have to get blood transfusions. And they can get a blood transfusion if they get too low, but the problem is, since your body's already weakened and have as many white blood cells and stuff like that, they really have to be very careful to give you a blood type that's very similar, a lot more closer to your blood type than they would otherwise, because and they have to have treated it. A lot of times they put radiation treatment on the blood to kill any possible bacteria or viruses that might be in there. Normally, as long as it was taken from a healthy individual, if there's a few bacteria or viruses, they wouldn't worry about it too much. Your body could fight it off. But with someone under cancer treatment, if their white blood cells are depressed, and not very many of them, then that can be a lot more of a concern. Okay, excuse me, sorry. Sorry, I had to put my mouth in the corner of my elbow there for a second. All right. Anyhow, this is a picture in your book. How does your body, we talked about, is maintaining homeostasis? It needs to keep the same level of oxygen and stuff like that. So it needs to have some way to monitor and adjust for oxygen levels. Okay. So let's just say you have normal oxygen levels, everything's good, but then all of a sudden it dips, and now you have lower numbers. So you have decreased O2 or oxygen levels available to the blood, okay? Because you don't have enough red blood cells or whatever. Maybe your tissue, when you run, you need more red oxygen, so you don't have as much oxygen levels. Okay, so your body says, whoa, we don't have enough, okay? So you have declining oxygen levels in the blood. Now, as the blood goes through the body, a certain amount of it is always going through the kidneys. Whoops. All right. And the kidneys, because the kidneys are filtering the blood and stuff like that. Now, while they're there, they are evaluating it. If there's not enough oxygen, they will release something called erythropoietin, okay, which is a hormone, okay, and they dump that into the blood as it goes through the kidney here, and it goes into the blood. Now, when that blood gets to the bone marrow, this hormone, erythropoietin, will react or stimulate the bone marrow to increase the amount of red blood cells. So it has all these myeloid stem cells that can turn into different kinds of blood cells. Well, now it says, hey, we need more of those to turn into red blood cells. And so it increases the process of erythropoiesis. Erythro means red, poiesis means to make. So this is the process of making more red blood cells. Erythropoietin is the hormone that causes it. And that the end result of that is going to be that you're going to have more red blood cells. Okay, as you get more red blood cells, then you're also going to have increased oxygen levels in the blood, and that will restore it back to normal. Okay, this is another reason why exercise is good for you. It increases the number of red blood cells, because when you exercise, you get short of oxygen, so your body tries to make more red blood cells so that you can get more oxygen, and that's also helps you have more oxygen, so you can run, do whatever, compete better, because you can burn energy better because you have more oxygen levels. All right, if we look at number 23, it says check all the factors that would serve as a stimulus for erythropoietin or poiesis. What are some things that would stimulate your body to make more red blood cells? So the first one is a hemorrhage, and that would be checked, because if you're losing blood, then obviously you're going to be short, and so it's going to try to make more red blood cells. Number 2, aerobic exercises. Using exercise that uses a lot of oxygen, that's going to encourage your body to make more red blood cells so that you'll have enough. Number 3, living at high altitude. High altitudes, we said, are thinner air. There's not as much air, and so there's not as much oxygen. So that's going to kick this off and say, hey, we need to make more red blood cells. All right. And then the last thing, breathing pure oxygen, like in an oxygen tank or something, would not, because then you're going to have high oxygen levels, and so that's not really going to stimulate it to make any more. All right, now that process that we just talked about is all for erythropoietin, or the red blood cells, but that does not affect the white blood cells. There are a couple of hormones that control white blood cell formation. There's one that's called CSF, and that stands for colony, a clump of these white blood cells, stimulating that is an S. I'm not sure why it has that other thing there. Colony stimulating factors. Okay, and there's another one that are called interleukins. Okay, leukins has to do with white again. So, but these two things, CSF and interleukins, are released. Now, usually they're releasing either some kind of inflammatory chemicals. Anytime your body has an infection or something causes it to be irritated, physically irritated, like a splinter or something like that, but it will release these inflammatory chemicals, the ones that also tell the white blood cells how to get there. But it will also stimulate your body to make more of them. If your body is exposed to bacteria, okay, or possibly some of the toxins that the bacteria make, viruses, so forth, all these things, if you're exposed to them, then it will stimulate your body to make more of the white blood cells, which makes sense because they're going to try to fight those things off. Okay. All right. The last thing we said, if you get too many white blood cells, that's leukemia. And to do a test for that, usually they take either a sternum puncture, which sounds like it, just right there. It's right at the surface. They can go to your breastbone and take a sample of the bone marrow there, or an ilium puncture over here on the hip bone, because those are both real close to the surface, and they will examine it microscopically, which is called a bone marrow biopsy. Biopsy just means looking at living tissue under the microscope, and they will tell whether or not it is cancerous. Okay. Sometimes we say the doctor diagnoses cancer, but technically it's a cell technician that looks at the sample under the microscope who actually determines whether you have cancer or not. All right, and that takes us through number 25, and we'll stop right there, and we'll see you on the flip side.